Joint pain in older adults can have various causes, and it's important to consider a range of possibilities when making a differential diagnosis. Here are some common conditions that could be contributing to joint pain in older individuals. 1. Osteoarthritis. This is one of the most common causes of joint pain in older adults. 1. It involves the breakdown of cartilage in the joints, leading to pain, stiffness, and reduced mobility. 2. Rheumatoid arthritis. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune condition that affects the joints. 2. It causes inflammation, pain, swelling, and potential joint damage. 3. Gout. Gout is a form of arthritis that occurs when there is a buildup of uric acid in the bloodstream, leading to the formation of urate crystals in the joints. 3. This can result in sudden and severe joint pain, often affecting the big toe. 4. Psoriatic arthritis. This type of arthritis is associated with psoriasis, a skin condition. 4. It causes joint pain, stiffness, and swelling, often in combination with skin symptoms. 5. Septic arthritis, also known as infectious arthritis. This condition occurs when a joint becomes infected, leading to pain, swelling, and warmth in the affected joint. 6. Bursitis. Bursitis involves the inflammation of the bursa, small sacs of fluid that cushion and lubricate joints. 6. This can cause pain, swelling, and limited range of motion. 7. Lupus. Systemic lupus erythematosus is an autoimmune disease that can affect joints, skin, kidneys, and other organs. 7. Joint pain and swelling are common symptoms. 8. Polymyalgia rheumatica. This condition primarily affects individuals over 50 and causes pain and stiffness, usually in the shoulders, neck, and hips. 9. Osteoporosis. While not primarily a joint condition, osteoporosis can lead to fractures and chronic pain, including pain in the spine and joints. 10. Fibromyalgia. Although not a joint disorder, fibromyalgia can cause widespread pain, including in the joints, along with fatigue and sleep disturbances. 11. Degenerative disc disease. This can lead to pain in the spine and adjacent joints due to the breakdown of intervertebral discs. 12. Hypothyroidism. An underactive thyroid gland can cause joint pain and stiffness. 13. Peripheral neuropathy. Nerve damage can cause pain, tingling, and numbness in the extremities, which might be interpreted as joint pain. 14. Cancers. Certain types of cancer, like bone cancer or leukemia, can cause joint pain. Diagnosing the exact cause of joint pain in older adults often requires a comprehensive evaluation by a healthcare professional. They will consider medical history, physical examination, imaging tests, like X-rays or MRIs, and possibly blood tests to determine the underlying cause of the joint pain and recommend appropriate treatment.